All right, here we go. Hello, everyone, and thank you for attending this webinar on how to complete 1,500 claim forms. Just a quick disclaimer. The information being provided is for educational purposes. It's not intended to substitute your clinical decision making or your billing protocols. It's not intended to be legal advice. CPT is a registered trademark of the AMA, and every attempt has been made to make certain that the information is 100% accurate. However, it's not guaranteed. We have a lot of offices attending today. Now, some of you are past attendees of our webinars, and some of you are members of Target Coding, and some of you are brand new to this platform. So, for those of you that have no idea who I am, let me tell you a little bit about myself. My name is Dr. Marty Kotler. I'm the president of Target Coding. I am a chiropractor. I practiced for 16 years prior to starting Target Coding. I'm also a certified professional compliance officer and certified billing and coding specialist. That's what all those letters are after my name. And my area of expertise is in compliance as it relates to coding, documentation, risk management, record keeping, Medicare, HIPAA, for insurance practices, for PI practices, for even cash practices. And I'm kind of unique because most doctors are not certified coders. Most certified coders are not doctors. So you'll see how I combine both specialties to help you improve productivity. I want to help you maximize reimbursement, reduce administrative burden, and show you how to get paid for everything you do. Target Coding has been helping thousands of doctors and their staff members for over 18 years with our products and services. Now, for those of you that are Target Coding members, you know the deal. You will get a certificate of attendance for attending today. You'll also get the playback recording if you'd like to listen to this again. You'll get all the PowerPoint slides and all the forms that I show. So give us 24 to 48 hours, then log into your account and you'll be able to retrieve all of these items. Okay. Any questions so far? Email info@targetcoding.com. Also, as we go through today's program, anybody that has any questions, you're better off emailing your questions to info@targetcoding.com instead of putting them into the chat box. Sometimes that just doesn't come through. So email any questions. It doesn't even have to be related to today's topic. Anything to do with chiropractic, billing, coding, documentation, Medicare, HIPAA, email info@targetcoding.com. And one of our staff members will get back to you right away. Okay, ready to get started? Ready to have some fun? I hope this is fun. I don't know if this is fun. I'll try and make it interesting. So here we go. There's a look at your screen. That's the 1500 form. If you've been around for 10, 15 years, some doctors still call it the HCFA form. That's not the name anymore. That's an old, outdated term. It's the CMS 1500 form. It's a universal claim form that every insurance company must accept. And we're going to be going through it. Now, this 1500 form is maintained by a company called the National Uniform Claim Committee. Some of the information I'm sharing with you comes directly from this company. The website is nucc.org. We're up to version 12.0 according to this company, NUCC. So the 1500 form has 33 fields or 33 boxes. I like to call them boxes. So boxes 1 through 8 are pretty straightforward. Box 1, you're going to check, is it a Medicare patient, a regular group health insurance patient, or other? 1A is the insured's ID number. 2 is the patient's name. 3 is the date of birth. 4, the insured's name. 5, the patient's address. 6, relationship to insured. 7, the insured's address. 8, leave blank. It says reserved for NUCC use. So the first 8 boxes are pretty straightforward. Actually, this form is separated. I like to separate it into 2 halves. The first 13 boxes is general information, demographics, date of birth, simple information. And then the bottom half, boxes 14 through 33, that's where you get to tell your story. So this form allows you to tell a story without sending in your notes, without calling the insurance company. That's what you're going to try and do. You want to send in clean claims and get paid without having to resubmit or call and verify, find out what's going on. That increases administrative burden. I'm going to show you how to decrease administrative burden. So we got through the first 8 boxes. Okay. Box 9 has 9. It also has 9A, 9B, 9C, and 9D. What are we going to do here? Well, B and C, it says reserved for NUCCU, so leave B and C, 9B and C blank. Now, 9, 9A, and 9D, we're going to come back to that. Why are we going to come back to that? Because we have to go to box 10 first. So, box 10 asks a question. Is the patient's condition related to employment? An on-the-job injury, a workers' comp case, yes or no? An auto accident, yes or no? Or other type of accident, yes or no? So then we move along to box 11D, and then it says, is there another health plan? So if the patient comes in, has primary insurance and no secondary, no supplemental, you'll check no. But wait, here we go. Let's take a look at a sample Medicare patient. Now, I know most of you see Medicare patients, even though you could be a full cash practice. About 35% of the doctors we work with are cash practices, except for Medicare. 99% of the doctors we work with take Medicare patients. So let's say patient comes in with Medicare as primary. Most Medicare patients will have a supplemental plan like, AARP. So let's take a look on how the claim would be filled out if this is a Medicare patient with AARP, a supplement. So when you get to box 11D, you have to check yes, there's another plan. Medicare is primary, AARP is secondary, so you must check yes to 11D. Now it says if yes, go and complete 9, 9A, and 9D. So let's say this patient is Michelle Smith. That's the name we're using, Mrs. Michelle Smith. She has Medicare as primary and AARP is her supplement. So we're going to go fill out 9, 9A, and 9D. There it is. There's her name. It says AARP in 9D, and there's the AARP policy number in 9A. Here's another scenario. PI patients. Many of you see PI patients, or some states call it no fault, personal injury, auto accidents. What happens sometimes? The benefits are exhausted, or the patient goes to an IME. No more benefits. State Farm, Geico, all states say, that's it. We're not paying anymore. Patient still has problems due to the injury. Patient wants to keep coming in. Patient, let's say, has an attorney. The attorney says, keep treating, and you decide you want to do that. And the patient or the attorney says, just bill the patient's regular health insurance. Okay, let's say this patient has regular health insurance like Blue Cross Blue Shield, or maybe it's a Medicare patient where their benefits were exhausted and they have Medicare as secondary. How do we fill this out? Let's take a look. Once we get to 11D, we have to say, yes, there is another plan. So you're letting, let's say in this case, Blue Cross Blue Shield, you're letting them know that, yes, there is another plan. Then we go to box 10, auto accident. Yes, you must check yes. Oftentimes, doctors will just automatically check no. Now, what have you done? You've submitted a false claim. Blue Cross Blue Shield, you're saying no, this is not related to an accident. That results in a false claim. It causes problems. You're checking yes. The patient is coming in for a condition related to an automobile accident. So you're checking yes to 11D. So let's say this is Michael Jones. He has Blue Cross Blue Shield. He was coming in, he had State Farm, no more State Farm, benefits exhausted. So you're putting in Michael Jones, 9D State Farm, 9A, that's the State Farm policy number, and you're letting Blue Cross Blue Shield know, yeah, this patient was in an accident. Okay, moving along to box 12. Let's zoom in on box 12. This is a authorization to release information. Okay, that's fine. Most of you have onboarding forms. Patient comes in. I'm hoping you have new patient onboarding forms that say, I authorize the release of my information to get my claims processed. Great. If you have that, then you could have signature on file populate in box 12. Do you really have a signature on file? Same thing with box 13. This is saying I am authorizing benefits to send to my doctor. Great. Do you want the insurance checks coming to you? Then box 13 should be signed by the patient, or you should have a onboarding form, an assignment of benefits form it's called, and then you could put signature on file. Make sure you have one. Now, target coding members, if you do not have an onboarding form, you could use a separate form. By the way, even if you're not a target coding member, if you'd like to get a copy of this form, just let us know. We'll send it to you. So this is a separate form authorizing the release of information. This form, in essence, substitutes box 12 and 13. So you could put signature on file. So that's it for the top of the form, the first 13 boxes. Now we start telling the story. Box 14, let's zoom in. It says date of current illness, injury, or pregnancy. Okay, so what are we putting there? For most patients, you're putting the date of the initial exam. The very first time you do an exam on a patient, that's the date that will typically go in box 14. In this case, I have October 15th. And then you have to put in a qualifier. The only one that makes sense in the chiropractic setting is 431. Then we have box 15. Typically, this is left blank. Very rarely do I see box 15 needing to be completed, but I've probably seen it all in the past 18 years. Sometimes a claim will get denied. We need box 15 filled out. So if that's the case, it typically works by putting either 454 as the initial treatment or 444, first visit, and then you put in the date. Moving along. 16 typically leave blank. 17, okay, this one could cause some problems. It says name of referring provider. Let's zoom in on 17 and 17B. Name of referring provider. Did you have a provider refer you a patient? Then you may want to fill it out. See the example at the bottom of the screen? This patient was referred by Dr. Michael Smith, a medical doctor. DN means referring provider, and then you would put in Michael Smith's NPI number. Here's a source. Well, here's a situation where we've gotten doctors and staff members and billing companies contact us saying we got denied. The insurance company wants the name of the referring provider in 17, or else they're not going to process the claim. And the office says there was no referring provider. This patient came in from a Facebook promotion, or came in from a just walked in off the street, or we found this patient at a health fair. There's no referring provider. What do we do? Do you know the answer? The answer is, doctor, put in your own name and your own MPI number. So if there's no referring provider, just put in your own name and your NPI number, and then the claim will get processed. 18, you typically leave blank. 19, you may need to enter the date the x-rays were taken or the date of the part exam. This is for Medicare purposes. 20, outside lab. Oh, okay. A few of our, I would say only about 10% of the doctors we work with are doing lab work in their office. Most of the time you answer no. Okay, 21, this is where we really get into telling the story. Probably the most important box. 21, that's where you list your diagnosis codes. Use good diagnosis codes. If possible, use long-term treatment diagnosis codes like what? Herniated disc, sciatica, radiculopathy. If you use short-term treatment codes like muscle spasm and just pain codes, you might get denied after about 6 visits. So there's definitely a strategy with box 21. Now, box 21, if you look at the zoom in version, it says relate A through L to box 24E. Okay, so now we have 21 and 24E need to be communicating. They need to do a technology handshake, is what I call it. That's called diagnosis pointing. So I have a sample 1500 form if anybody would like a copy of this. If you're not a member, members, you get this. If you're not a member, you want a copy of this 1500 form, just email info@targetcoding.com. So this is called diagnosis pointing. So we have a chiropractic adjustment in box 24. We're going to get to that in a few minutes, but 24 has 98940. 24E has A and B. What is in 21A and 21B? Those are two lower back pain diagnosis codes. So we're adjusting the lower back. Next, 97140. If you're not using that CPT code, that's manual therapy. So in this case, in 24E, it's pointing to diagnosis codes cervical radiculopathy and cervical myofascial pain. And what are we doing? Manual therapy, just C and D. We're not adjusting the cervical region. Then we have unattended electrical stim pointing to thoracic problems. And then we have therapeutic exercising pointing to the lower back. Moving along, 24B. That's the place of service. If you're treating the patient in your office, you probably know the number. It's the number 11. We have a few doctors that go to the patient's home to do the treatment. That's the number 12. Few of the doctors we work with will go to the patient's work site, place of employment. That's number 18. There's many, many different types of place of service codes. I just gave you the ones that are most common. Then we move along to 24D. Okay, now we need to put in the procedure codes, the CPT codes. Remember, there's a difference between CPT codes and diagnosis codes. CPT codes are what you're doing. Diagnosis codes are why you're doing what you're doing. So we have a re-exam 99213, manual therapy 98940 with modifier AT. We're not going to get into modifiers today. We have a whole separate webinar just on modifiers. 24E, we went over that. That's the pointer box. Then we have 24F, G, J. Let's go through these. 24F is the charges. 24J NPI, 25, your tax ID number for most of you, and the patient's internal account number in your office in box 26. Now, 24G, that's where you put in units. Do you provide CPT codes that are time-based, like manual therapy, therapeutic exercises? I would say most of you do time-based codes. Now, let's go over that because there is a lot of questions we get on the 8-minute rule. So Medicare has this 8-minute rule. The AMA has something called the midpoint rule. So here are the time ranges. If you just do 1 unit, it has to be done for at least 8 minutes. Less than 8 minutes, you should not bill for it. Document that you did it. If you did something for 5 minutes, that's a time-based code, you can't bill for it. I know sometimes we hear, shouldn't we bill for everything we do? No, document everything you do. You don't necessarily have to bill for everything you do, but you must document it. So 1 unit, 8 to 22 minutes, 2 units, at least 23 minutes. So let me give you an example here of the difference between the Medicare 8-minute rule and the AMA rule. So let's say we do 25 minutes of 97110. Follow that with neuromuscular reeducation for another 25 minutes. What's the total? 50 minutes. Now, you would think logically, well, we did each one for at least 23 minutes. We should be able to bill 2 of each. No, only 3 units could be billed. The total time here with Medicare, you have to use total time. 50 minutes falls in between 38 and 52, only 3 units. Now, the same thing, 25 minutes of therapeutic exercises, 25 minutes of neuromuscular reeducation using the AMA midpoint rule. You have to do a little math. Started with 25 minutes of therapeutic exercises. So we go 15 minutes. That's at least 1 unit. 25 minus 15 equals 10. The midpoint is 8 minutes. We got above the 8 minutes. So for 25 minutes under the AMA midpoint rule, we could build 2 units. Same thing for neuromuscular reeducation. Now, here's the problem. For some of you, this could be great news. Most of you follow the Medicare 8 minute rule because that's what my experience has shown with audits. 99% of the insurance companies follow the Medicare total time 8 minute rule, but there is a difference. Now, back to 24J, box 24J. For those of you that want to go on vacation, you deserve a vacation. There's a Q6 modifier. It means services furnished under a compensation arrangement by a substitute physician or if you go on vacation or you have a health issue, you have a doctor that's covering your practice. Latin term is locum tenens. So you have someone covering your practice. This is a Medicare Part B patient. You could have everything the same as if the doctor that was on vacation on the claim form. The only thing you need to have is the Q6 modifier on every code. And the covering doctor doesn't even need to have a Medicare PTAN. Be nice if the covering doctor does, but doesn't have to. Now, you may be wondering, what about non-Medicare? Non-Medicare, if they don't follow the Q6 modifier rule, then the covering doctor's individual MPI number goes in 24J. The covering doctor's name and credentials in box 31, which we didn't get to yet. It's coming up. So 24J has two areas. You'll see there's a shaded area and an unshaded area. In the shaded area, we've seen this happen where the insurance company wants the chiropractic taxonomy code, and there it is. For chiropractic, it's 111N, 5 zeros, and the letter X. In the shaded area. That's why I have it shaded in red on this slide. Box 27, accept assignment. Doctors, do you want the checks coming to you? Then you check yes to accept assignment. If you're in network, you don't have a choice. Even if you check no, you're getting the check if you are in network because you signed a contract. Out of network doctors, you have a choice to accept assignment or not accept assignment. If you don't accept assignment, that means the patient could pay you, and hopefully the insurance company will send the check to the patient. I have a doctor in North Carolina. He is out of network. He's a cash practice. The patients are paying him. He leaves box 13 blank. Remember box 13, assignment of benefits? He leaves it blank. He checks no to box 27. He doesn't want the checks, but they're still coming to him. He's getting paid by the patient. The insurance company is sending him money. Now, that's not the worst scenario to have, to get paid twice instead of none. So he has to either send the check back or give the patient a credit. So he's got a little bit of an accounting issue, but at least he's getting paid. Box 31. Oh, 28, 29, 31. Let's go over that. So in box 28, the total charge, 29, amount paid, 31. Whoever's touching the patient, typically, if it's not a locum tenens Q6 situation, should be that doctor. Whoever's touching the patient, that doctor's name is in 31. That's been an issue with some offices where the doctor is not in the office, but yet everything's going out under the owner's practice name. And he has or she has associates that aren't in network with an in network plan seeing patients. Careful with that. 32 is the address where the services are being rendered. And then we have 33A and B. 33 is unshaded. 33B is shaded. So 33A, there's the individual NPI number. Some people call it the primary NPI number. 33A could also be the group NPI number, or NPI 2, as some offices call it. Medicare calls it the organization's NPI number. It gets confusing, especially when it comes to credentialing. So make sure you have all of those NPI labels proper. And then for the shaded area, you may need to put in the chiropractic taxonomy code. Here's a sample primary Medicare Part B 1500 form. This patient doesn't have secondary supplemental, so in 11D, we're checking no. Is there another health plan? No. And then with Medicare, you should know this in box 21 is subluxation, then a neuromusculoskeletal code, then a subluxation, then a buddy neuromusculoskeletal code. So it alternates subluxation, maybe a radiculopathy code, subluxation, pain code. In this example, it's subluxation in the lumbar, followed by lumbar radiculopathy, cervical subluxation, followed by disc degeneration. You see it on x-ray at C5, C6, that's M5 0.322. Once the patient gets to maintenance with Medicare Part B, you have to give them a choice. Mr. Taylor, you want to keep coming in? Oh, you would like to? Well, Medicare doesn't cover maintenance care. You want to keep coming in? Oh, yes, you do. Take a look at the ABN form. And the patient checks yes to option one. Now you have to submit just for denial purposes using the GA modifier. GA. ABN form, by the way, is only used with those red, white, and blue card patients, the Medicare Part B patients, not for Medicare Advantage plans. Don't use the ABN form. If you're not enrolled in Medicare Part B, you're not allowed to see Medicare Part B patients. Wait, Dr. Kotler, what do you mean? I can't just do exams and decompression? No, sorry. Here's a sample PI. See in box 10, auto accident, yes. Oftentimes you're using S codes in box 21. Those are the trauma injury codes like sprains and strains and contusions. Here's a cash practice giving the form to the patient. Patient comes in. Ideally, it would be nice if a cash patient just came in and paid cash, didn't ask for a receipt, didn't ask for a statement. Staff members listening to this, isn't that the ideal patient? Cash patient doesn't want a receipt, doesn't want a statement, doesn't want anything. Well, unfortunately, most patients will want to try and recoup the money they're paying you, especially if they have pain and restricted because they have insurance. I would say now statistics show that 92% of the American population have insurance, and that insurance covers chiropractic. So let's think about this. I'll go a little easier. 8 out of every 10 patients that show up at your office have insurance and has a chiropractic benefit. But wait, I'm a cash practice. That's fine. But many of these patients will need to be explained that even though you're a cash practice and the insurance might not cover what you do, it takes explaining. And forms need to be signed. This is a wellness patient. S8990 is a wellness adjustment rather than for restoration. Patient wants to try and recoup the money that they're paying you. You could use S8990 for pretty much every patient except your Medicare Part B patients. Now, a couple of action steps I'd like to go over with you because what should you be doing? You want to improve reimbursement and safeguard, protect your practice against non-compliance accusations. Let's go with step one. Be proactive. Avoiding problems is better than having to deal with them afterward. Don't wait for the oil light to flash on your dashboard. Any questions you have about your practice, have a compliance expert answer those questions. Do you have a compliance expert? If you can't think of one, now you can. That's me. I'm the compliance expert. Act in advance to deal with unexpected problems rather than just reacting after things happen. Just about every doctor that I've helped with a post-payment audit always says, I should have contacted you sooner. It's like patients. They've had sciatica for 15 years. They come in after 6 visits, there's no sciatica. What do they say? I should have come in sooner. Step two, patient forms. This is what I call the breadcrumb trail. The first breadcrumb that you should be dropping down are your forms. Ensure that all new patient forms are fully completed before treatment begins. What did they write on the form? Look at what the patient writes. Sometimes it doesn't make sense. It says chief complaint on the form, and the patient wrote free exam because you had a promotion. That's not okay. Make sure the forms are fully completed, no blank spaces. History form, review of system forms, assignment of benefits, informed consent, financial policies, HIPAA notice. You need forms, you came to the right place. We offer forms. We have a packet of 100 forms that cover just about every situation that you need in your office. Would you like us to review your forms? Have you send us your forms. We'll do a form scrubbing. Send us your forms. You can send us blank forms if you would like, and we'll send you our forms to replace your forms if necessary. We charge for this. If you're not a member, we charge $3.95. Get a form scrubbing. Step 3, review the policies. If you bill insurance and you're accepting money from insurance, review the policies from the insurance companies that you bill. There's a sample from Aetna. We have it for every insurance company. Here's another thing, doctor gets audited. The insurance company says, we want money back because you didn't follow our policy. I speak to the doctor. I said, doctor, did you know they have paid the insurance company has a policy on medical necessity? 90% of the time, the doctor says, no, I didn't know that. Get your hands on it. Step 4, code pairing. See, your CPT codes are what you're doing. Your diagnosis codes are why you're doing what you're doing, and they should pair like food and wine, like peanut butter and chocolate. Example, you're billing 97110 therapeutic exercises, but you don't have anything in your notes or diagnosis code about decreased range of motion or muscle spasm, muscle strains. You can get audited. You'll have to give money back. So audits, do self-audits. Conduct a coding, billing, and documentation self-assessment to ensure compliance. You might not know how to do that. If you need to know how to do it, let us know and we'll show you. You don't want to get letters like this. This doctor got a request for $640,000. This doctor is being asked back for $300,000. These are examples of the clients we worked with. So maybe you want to get a SOAP note review. Can your SOAP notes survive an audit? Maybe, maybe not. Send us a few notes. We'll send you our notes. We'll compare. We charge $4.95 for this. Here's something you might not know. We've saved our clients over $1 million in post-payment audits. Yes, you heard me right. We've worked with numerous doctors, probably about 100 post-payment audits over the past 18 years, and we are good at negotiating on your behalf. Sometimes it's a large amount where we need to get an attorney involved. Attorneys love me because what I do is a forensic evaluation of your notes. I find things that the insurance company didn't know you did, and I'm great at negotiating. When a payer seeks to recover previously paid claims, we'll review them, identify issues, and negotiate. We'll reduce the hit that you're getting. If you've never been audited, great news. If you have a friend that's being audited for a post-payment audit, let them know about us. If you know any attorneys that specialize in audits, let them know about me and my company. We'll fight for your practice. Step 6, webinars and seminars. Regularly attend webinars and seminars to enhance your practice, expand your ability to serve more patients. Be a sponge, always keep learning. By the way, that's a photo of me. You probably can't see me. I look tiny on the stage there, but this is the largest audience I've ever spoken in front of, 900 people. My largest audience I've ever spoken in front of. There's a picture of me on stage. Step 7, policies and procedures. You should have a policy and procedure manual. Doctors, do you want staff members to have structure and be organized? They do. You don't have to ask them. They want structure, they want organization. You should have a billing and coding policy and manual that outlines your procedures so everybody's on the same page. Here's something a lot of chiropractors do. Adjust full spine, but only bill insurance 98940. Can you explain why? Are you downcoding? How about your fee schedule? You're billing PI 250 a visit and your cash patients are only paying 50 for the same services? Doesn't make sense. Have a policy manual that explains all this. We could do it for you. It doesn't cost that much and you'll be able to SWAN. You've heard that acronym, SWAN, sleep well at night? One of my favorite acronyms. We'll put together a policy manual for you. So prevention is the key. Target coding provides tools, resources, strategies. What are some of the things that we offer? Webinars. We offer webinars, many webinars. Look at all the different types of webinar topics. Some of these are live, some of these are on demand, some of them include CEUs, some are non-CEU, SOAP notes, Medicare, HIPAA, ICD-10, PI, fee schedules, cash practice, rehab procedures, shockwave, treatment plans, modifiers, CA boot camps, many more topics. Attend our webinars. You'll love them. You could become a member. We have 4 levels. Let's start with the least expensive one. Level 1 is $99 a month, unlimited questions and answers, attendance to all of our webinars, monthly videos and newsletters, $99 a month, pay as you go. It includes all of our CA boot camps. You don't want to become a member? That's okay. If you don't want to become a member, you could work with us 1 hour at a time. We have a lot of choices. It's not one size fits all. When I first started consulting 18 years ago, I had one package. It was $7,000. It included everything. Now we break it apart. Some people didn't need all of it. Some offices couldn't afford $7,000. So we have little bits and pieces. We do credentialing on Medicare. Need a Medicare PTAN number? Let us know. You're hiring an associate chiropractor because you're busy. Good for you. Good for you. Now, that associate chiropractor is going to see your Medicare patients. You need to have a form filled out. It's called reassignment of benefits. If you don't, checks will go to this associate doctor's previous practice. You don't want that happening. Or to this associate doctor's home. You don't want that. Get this taken care of to prevent problems. I mentioned our forms program, SOAP notes, billing and coding, HIPAA. I would say 80% of you do not have a HIPAA policy and procedure manual. Why? You're risking your practice from getting an audit on HIPAA. It's not worth the time. Invest in your practice. It's not an expense, it's an investment. I mentioned our forums and we do credentialing. I have a book that I wrote on the best codes to improve reimbursement. It gives you the codes that pay for the most visits. You get cheat sheets emailed to you. We show you how to pair your codes. I mentioned pairing your codes. I gave you an example with therapeutic exercises. Here's 97140 pairing with M7912 or herniated discs. Traction pairs with back pain and radiculopathy. FAQs. Oh, excludes one. Denials are occurring more than ever. You might not even know why. If you're a staff member in the billing department, wait, why did we get denied? We've been getting paid for these claims for the past 5 years. All of a sudden, we're getting denied, can't figure it out. It could because of the excludes one edits. Example, you submitted a claim with low back pain and strained low back muscles. You can't do that. You submitted a claim with a low back herniated disc and low back radiculopathy. You can't do that. M62 codes and M79 codes on the same claim will probably get denied. So we send you a cheat sheet on that too. That's part of the book. You could use this book as the topic of the day when you're doing your billing and coding training with your staff. 3 hours per year is required for your billing and coding staff members. 3 hours per year. You need a testimonial? Let us know. We have hundreds of testimonials. Follow us on Facebook, Instagram, LinkedIn, YouTube. I have many free videos on YouTube. I just uploaded a couple of videos to YouTube. Go to YouTube, put in the search area target coding, you'll see my videos. Watch them. I think you'll enjoy them. We get feedback on our webinars and YouTube videos. People like what I have to say. I make it interesting. Sometimes I make it fun. So here's my contact information. Info@targetcoding.com is the email, website targetcoding.com, telephone number 1-800-270-7044. If you need to fax us a document that has patient information on it, you don't have to white out or black out names. We have a HIPAA secure fax number, 844-831-2347. Would you like to set up a free consultation and speak with me? Do it. I'm happy to do it. I'll be thrilled to talk to you. Want to become a member? Fine. You don't want to become a member? Pick my brain. You want to buy a book? You want to attend a video, a webinar? Need a manual? We'll give you choices. We're not going to sell you something you don't need. Scan that QR code and set up a consult, or give us a call or send us an email. All right, we're done. I want to thank everybody for attending. I hope you learned a lot. Take care, everyone. Bye bye.